listening to Planet Vero Radio. I am Cindy Schwartz. We are broadcast on iHeartMedia, also podcast on Spreaker. This is the Patient Partners Show, where we talk about medical topics, how to help people, how to help patients, not be abused, not be harmed, and try to give information on what's the best way to get really good care and those kind of topics. I've got my co-host Jeannie Roller on Skype with me from Indiana. Jeannie, we're talking today about education in the medical system, just kind of a topical discussion, because on a couple of podcasts ago, we were talking about why are so many patients' rights being obliterated, being abused, being, just schlepped to the side. People are naked for umpteen reasons, for surgeries that it doesn't seem like they should be naked for. For instance, a foot surgery, and the patient is totally naked with a catheter, and the surgery takes 15, 20 minutes, and we're just wondering about some of these questions. So I asked you to delve into it a little bit. I know some stuff by people that I've interviewed, doctors, nurses, and what have you, in the years that I've been doing this, trying to get information for everyone and for myself too. I mean, I go to doctors when I need help too, and I'm just appalled at some of the things that I've been told when I've asked for female techs or female nurses and stuff for intimate procedures. And I think really that's the big thing that we talk about, is for the intimate procedures. Certainly it doesn't matter what kind of tech you have if you're having your blood pressure taken and things like that. But intimate procedures, in my opinion, it does matter. It is a big deal. And so I have talked with people, interviewed a lady who's a professor up at the Pensacola, Florida area, and she teaches surgery techs. And she herself told me in an interview, and it's on this podcast, that most of the techs aren't really even trained, that there's no certification, there's no licensing, and I believe still this is nationwide. I know there were different things that were getting worked on different legislatures to try to maybe not combat, that's not the right word, but to get a rein on this. It's just seemingly willy-nilly people that are in the surgery ORs. They're trained by the hospital, and they're not specifically going to classes. They're getting degrees and whatever. Yeah, there are surgery tech degrees. I mean, I can hear people saying, what is she talking about? There's a lot of surgery techs that are trained, and I get that. But there is no across-the-board stipulation that has to be done. A hospital can, as far as I know, right now, in all 50 states, hire someone. They could hire you, Jeannie. They could hire me. And I wanted to be a surgery tech, and they would teach me right there at the hospital how they want to have it done. So what do you think about all of this? I mean, we're wondering why there's so many discrepancies. You go to one doctor's office, all of your patient rights and whatever are completely taken for granted. You go to the next doctor's office, the next set of nurses, and your patient rights are totally valid. That all the I's are dotted, all the T's are crossed. And we can't say, we know, Jeannie Roller and I do, Misty Roberts, another partner of ours on patientmodesty.org, we know a lot of these doctors that you really shouldn't go to these offices, but we can't tell you that. We're not legally allowed to tell you that. We don't want to see anyone get harmed. So we're kind of trying to delve into some of this stuff, going, is it the education that people are getting or not getting? What's the deal with this care that a lot of people are getting in their harmed patients?
Well, let me say a couple of things first. I will be writing on the website, patientrightsinfo.com, on the blog, more on this subject, because we can't cover it all in 10 minutes.
Right.
The other thing I found when I was doing research is, it really is not a whole lot being said about this, because I guess in the U.S. they don't want us to know. They keep it quiet. But for me, I did a lot of different research, and basically doctors are educated one way and nurses and techs are educated another way. But when they all come to the hospital clinical setting, then it seems like most of them decide to do however they want, and that is usually at the expense of the patient. Now, I came across one article by the Medical Group Management Association, and I mean, it's entitled "Patient Safety and Modesty: A Risk Management Approach," and they talked about modesty, which really grinds on my one nerve because this isn't about modesty.
Right.
This
I was
is about
yes.
your right to dignity.
Mm-hmm.
And they said that clinicians have been trained to avoid sexual thoughts, but patients, this is not the case. So, right there, they're kind of saying that it's on us if we think sexual things are happening. No, it's not. The other thing that they put sexual harassment by patients in here before they talked about sexual assault of patients by medical personnel.
Mm-hmm.
So, they think that patients are more dangerous to the medical provider rather than to the medical provider is to the patient. And it says on sexual assault of the medical patient, it says, to be very clear, only a very few small minority of physicians and other clinicians are caught
Mm-hmm.
sexually assaulting patients. So right there, they said it all. Very few are caught.
Mm-hmm.
That is true. Very few are caught because it takes literally 500 to 1,000 patients to be sexually assaulted before they will even be type of investigation.
Mm-hmm. Well, look at the most recent.
The other thing.
Go ahead.
The other thing that I came across were doctors are taught in med school on cadavers, dead people.
Mm-hmm.
So they teach them on these naked dead bodies to become insensitive to humans, live humans, to be naked. So they become insensitive to that. Nurses and techs are taught to respect patient dignity, the right to privacy. However, article after article states that once you become part of a hospital setting or clinical setting, that all goes out the door. It is however the hospital or the clinic decides it's going to happen.
So it's another one of those things really where it is a business, and we've heard this so many times, and just kind of any company or whatever, what have you, that the manager, which in this instance it would be the doctor or whoever the highest level person is, yeah. Right, sets the tone.
Right.
It sets the tone. So if you have a bad crew, it's a bad management. If you have a good crew, it's good management, that kind of thing. So that seems to be the consensus of that. The other thing I want to say, too, is when you were saying before, Jeannie, that there's 500 to 1,000 people. Look at the most recent cases because they're coming out little by little, and it's so sad to see that these people have had to suffer for umpteen years, and now they're finally being believed. At the University of Michigan, Larry Nassar, we've talked about that. There was the doctor out in California. There's so many I can't. It's sad that I can't name them because it's just mind-boggling. That they were sexually abused, they were harmed, they have PTSD, they have medical trauma, all of this. Why isn't anyone recognizing this at the level and doing something about it now? Why do we have to have and it's not about the money. Why do we have to have these lawsuits?
That's just it, because this stuff doesn't get talked about.
Right.
It keeps happening.
Yep.
So,
and you can't change anything if you don't talk about it. There's no communication.
It said that this one study dealt with how physicians and nurse comfort during this, but the theory seems to be that if the nurse and doctor is comfortable about the nudity, then the patient should be comfortable too. No one talks about, do the physicians or nurses ever actually know whether or not the patient is comfortable?
Right. Well, we've said it so many times. They tell you you're under anesthesia. It doesn't matter.
Right. And that is the big problem. It works for them because it's not them.
Well, it works for them because it's quicker and it's easier. Right. So give the website one more time, Jeannie. We've got like 30 seconds left.
PatientRightsInfo.com.
Okay, and you can call us. You can contact us with info@PatientRightsInfo.com with any questions or comments or whatever you want to say. You've been listening to Planet Vero Radio. Please stay tuned.